Now we have topic about anti-arrhythmics. So here we go. After learning of anti-arrhythmics, we should be able to describe the classification system for anti-arrhythmics, list common anti-arrhythmics as well as their mechanism, indications, and their side effect. Choose an appropriate anti-arrhythmics in special clinic situation. Identify that are likely consequences of pro-arrhythmic side effect. How heart arrhythmia is a medical condition characterized by the abnormal beating of the heart. Why hard to learn? Why is there too hard to learn? There are many drugs to learn. The physiology of the cardiac action potential is complex. The pathophysiology of the arrhythmias is also complex. All anti-arrhythmics have pro-arrhythmic side effect. Action of anti-arrhythmic are too complex for perfect classification. Myocardium include typical and atypical cardiomyocytes, pacemakers which form the cardiac conduction system. Excitation from the arterioventricular node in normal conditions is possible only in one direction. Retrograde direction of pulses is impossible. The most important prescribed for the work of cardiomyocyte is the anatomical integrity of conduction system. In this picture you can see that the Beckman bundles left branch LWEB, right bundle branch RWB, bundle of his antivehicle AV. These are myocardium bundles. Action potential is a brief alteration in the electrical potential, also known as voltage across a cell membrane, that propagates along the cell and spread from one cell to the next as mean as sending a signal. There is a similar process that happens in the heart. In normal situations, a signal is generated by the sinus node, travels by action potential through the artery, telling them to contact. The signal then reaches the AV node where there is a brief delay. This is then followed by the continuation of the extra potential mediated signal through his Purkinje network, eventually reaching the ventricle and telling them to contact. Then there was the depolarization and repolarization. In depolarization, you can see that in extracellular, intracellular, and there is a cell membrane. There is a cell membrane. Cell membrane inside and outside. Inside there is a 10 potassium and sodium and calcium. While outside there is lower potassium, higher sodium, and higher calcium. While inside there is higher potassium, lower sodium, and lower calcium. ECG records the electrical signal from heart to check for different heart conditions. Electrodes are placed on a human chest to record heart electrical signals which cause a human heart to beat. The signals are shown as waves on attached to computer monitor or printer, as you can see in figure. The P wave. In this picture, you can see the P wave. The P wave represents the wave of depolarization RTM and usually 0.08 to 0.10 second. That's about 82 to 100 ms in duration. That is P wave. PQ wave represents the wave of depolarization that spread from SA node. And QRS complex represents ventricular depolarization. The duration of the QRS complex is normally 0.6 to 0.10 second. And T wave represents ventricular depolarization. And QT interval is the time from start the PQ wave to the end of the T wave. It represents the time taken for the ventricular depolarization and repolarization. And the Singh-Wiggum-Williams system, while Wiggum-Williams and Brahma and Singh, there are two people who invented this. One of the doctoral student Brahma and Singh contributed to development of the classification system. The system is before known as the Singh-Wiggum-Williams classification. The system divides the anti-arrhythmics into four classes depending upon their primary mechanism of action. The system divides anti-arrhythmics into four classes depending upon their primary mechanism of action. Anti-arrhythmic drug classes: class 1 sodium channel blocker, class 2 beta blocker, class 3 potassium channel blocker, class 4 calcium channel blocker. Miscellaneous adenosine electrolyte supplement magnesium and potassium salts digitally compounds cardiac glycides. So there is class we have class 1 which consists of sodium channel blockers. Class 1 I have has subsequently divided into three IA, IB and IC. The differentiations in extracellular you can see plasma membrane, and ion channel there which is closed and other is open, from where calcium and potassium grow from inside to outside. Anti-arthritic drugs: class 1 sodium channel blocker, class 2 beta blocker, class 3 potassium channel blocker, and class 4 calcium channel blocker, as you see in the figure. Antiarrhythmic drugs: class 1 sodium channel blocker, class 2 beta blocker, class 3 potassium channel blocker, class 4 calcium channel blocker. Active arrhythmia mechanism: abnormal impulse formation and reentrant. In abnormal impulse formation, there are two types: regret activity atomically. And regret activity divided into two: early after depolarization or delay after depolarization, and that is divided into late phase, that is EAD. And automaticity enhanced pacemaker and divided into protective pacemaker. And regrant divided into three parts: reflection, circus movement, retentivity, and phase 2 reentry. And circus movement have been divided into two parts: no anatomical upstage or anatomical upstage. The electrocardiogram is of the greatest use in the diagnosing cardiac arrhythmias, acute and rare myocardial infarction, heart attacks, pericardial disease, and cardiac enlargement. Indication: class and example. Class is IA and example is coordinate procalcitonin. Procalcitonin only rate and rhythm control the previously cited FIB, and as you can see, preventing of fainting and phylakinide outpatient cardiovascularization back to sinus in patient with non-proximal as FAB. Classes: there is a 2 beta blockers, example is metoprolol, that is a medicine, acetobutol, and pinodolol, and isamolol. Mechanism: beta blocker propranolol also had some sodium channel blocking effect. Medical uses: decrease mortality in patients with myocardial infarction, prevent recurrence of tachycardia. The side effects of beta blocker include tiredness, cold hand, and headache. Sometimes these medicine affect your digestive system as well. Some players report stomach issues and constipation or diarrhea. Classes are one for calcium channel blocker, example verapamil, and diltiazem. Mechanism: C calcium 2 plus channel blocker. Medical use: prevent recurrence of paroxysmal and supraventricular and tachycardia, reduce ventricular rate in patients with atrial fibrillation. Calcium channel blocker in other tissues, resulting in side effects such as hypotension, peripheral edema, and constipation. Thank you so much for listening this topic. I appreciate.